So you've probably spent thousands of dollars and honestly endured hours in a dental chair to get your dental implant. It's a massive medical and financial investment, right? But here's a pretty stark reality we need to confront right up front. There is a very, very good chance you've been cleaning it completely wrong, literally every single day since you got it. Welcome to today's Explainer. Now, if you're feeling a little bit of panic right now, take a breath. Let me validate that confusion. You see, when most patients walk out of the clinic with their brand new implant, they're usually just handed a generic toothbrush and told one simple thing. Hey, just brush and floss like normal. And that's it. That's the extent of the instruction. But here's the thing. Treating your implant like a normal tooth is actually setting you up for failure. Don't worry though, we're gonna fix that today.
Here's our roadmap. We'll be tackling the big implant myth, why implants are anatomically different, your 4 essential tools, 2 critical mistakes you need to avoid, and finally, your daily action plan.
All right, let's dive straight into section 1, the big implant myth and the sheer danger of normal brushing.
Moving right along to section 2, why implants are different, the anatomical truth.
Okay, to really grasp why your old brushing habits are failing your new implant, and to totally bust the myth that you can treat an implant exactly like a natural tooth, we have to look under the hood at the anatomy. On one side, look at the natural tooth. It's cushioned and sealed by this thing called a periodontal ligament. Think of it like a natural protective barrier. But on the other side, look at your dental implant. Notice what's missing there? Yeah, no ligament. Instead, there's this highly vulnerable gap where the gum tissue just sits directly against the titanium abutment. Without that natural ligament acting as a seal, bacteria can easily, and I mean really quickly, sneak right into that space between your gum and the implant. And what happens when those bacteria sneak into that gap? Well, they cause something called peri-implantitis. Simply put, this is essentially gum disease that's specifically located around a dental implant. And it's triggered directly by that bacterial buildup and inadequate cleaning. Make no mistake, peri-implantitis is a serious, serious threat. It causes severe inflammation, it can lead to devastating bone loss, and ultimately, it can cause the total failure of the entire implant. Now, what's really alarming here is the sheer scale of this problem. To put this into perspective, studies show that a staggering 20 to 50% of implant patients suffer from some form of peri-implant disease. Wrap your head around that. Up to half of all patients with implants are experiencing issues. And the #1 culprit behind this massive failure rate? Just inadequate cleaning. We definitely don't want you to be part of that 50%.
Which brings us to section 3, the 4 essential tools, basically your personal defense protocol.
So how do we keep you securely in the healthy half? Think of this as the rule of 4 for building your ultimate defense routine. Tool #1 is a soft-bristled brush, or ideally an electric brush. Now listen, you might be super tempted to grab a hard brush and really scrub that implant clean. Absolutely do not do that. Rough brushing is incredibly dangerous for 2 huge reasons. First, implant crowns can actually scratch way more easily than natural tooth enamel, which literally gives bacteria a brand new place to hide. And second, aggressive brushing physically shoves bacteria deeper into that vulnerable gum pocket instead of removing it.
Here's the exact physical technique you need to master. Position your brush at a 45-degree angle right where the implant crown meets the gum line. You're going to want to use gentle, circular motions. Let me repeat that. Do not scrub back and forth aggressively. Instead, you want to spend 30 focused seconds on each individual implant, and you really need to do this twice a day. Precision and gentleness are your absolute best friends here. Moving right along to tool #2, the water flosser. Guys, this is the absolute game changer for implant owners. Now, you might be used to regular old string floss, but string floss can actually fray when it rubs against certain implant abutments. And when it frays, it leaves these microscopic fibers behind right in the gum line. And guess what? Those exact fibers directly trigger the very inflammation we're trying to prevent. Talk about counterproductive. A water flosser completely avoids this problem. It uniquely flushes out that highly vulnerable gap between the gum and the implant that your toothbrush literally cannot reach. And it does it without leaving any sneaky fibers behind. So here's how to use it. Set it to medium pressure. Don't blast it on high, okay? Aim the water stream at a 90-degree angle directly at the gum line, and then just run it smoothly along both sides of the implant crown. Do this once a day to flush out all those hidden bacteria. Okay, tool #3 is the interdental brush, which is sometimes called a proxy brush. These are those little brushes shaped kind of like tiny Christmas trees. Sadly, they don't bring presents, but they are absolutely perfect for getting into really tight gaps under implant-supported bridges
or from meticulously cleaning around the abutment right where it meets the gum tissue.
Now, the absolute most crucial point here is gentleness. You absolutely must choose a brush size that fits comfortably into the space without having to force it. Rule of thumb, if it doesn't slide in easily, it's too big. Stop right there and get a smaller size. You're going to use a very gentle in and out motion. Just like with your main toothbrush, there is absolutely no scrubbing and definitely no twisting. Just let the bristles do all the work as you glide it in and out. Finally, we have tool number 4, antibacterial mouthwash. Specifically, you're looking for a chlorhexidine, that's chlorhexidine, or a CPC-based rinse. While your brushes and your water flosser are your mechanical defense, basically physically removing plaque, this mouthwash acts as your chemical layer of bacterial protection. It reaches those microscopic bacteria that brushing and flossing alone simply can't get to.
To get the absolute maximum benefit, you're going to want to swish this rinse around your mouth for a full 30 seconds once a day, then spit it out. But wait, here is the single most vital instruction. Do not rinse your mouth with water afterward. Seriously, if you immediately rinse with water, you're basically just washing away the active chemical ingredient before it even has time to protect your implant. Just let it sit there and do its job.
All right, moving on to section 4, 2 critical mistakes that completely undermine your routine. Because look, even with the absolute best tools, things can still go wrong. This slide brilliantly illustrates the contrast between what you might be doing right now and what you absolutely must do. The first major mistake is skipping the water flosser just because it feels unnecessary or tedious. But doing that leaves hidden bacteria right in that vulnerable gum gap. You absolutely must use it daily. It's arguably the most important tool on your list. Mistake number 2 is ignoring implant bridges. Because there's a floating section of false tooth right above the gum, bacteria absolutely thrive in that dark little space. So you have to meticulously use a floss threader, your water flosser, or your proxy brush under there every single day. When you look at this whole routine, I really don't want you to just see a list of chores. Think about it this way. You are actively protecting thousands of dollars worth of dental work. You're directly preventing the inflammation that leads to devastating bone loss. Did you know that well-maintained implants in healthy patients have been documented to last decades? It's true. By doing this, you're giving your implant the absolute best possible chance of lasting 20, 30, or even 40 years. Which brings us nicely to section 5. Your daily action plan, or as I like to call it, tonight's homework. Feel free to go ahead and screenshot this checklist. Consider it your cheat sheet for long-term health. Step 1. Starting tonight, I just want you to spend an extra 30 seconds with your soft brush precisely at the gum line of your implant. Step 2. If you don't have one already, invest in a water flosser. Trust me, there are plenty of really great options out there for under $50. And step 3. At your very next dental visit, advocate for yourself. Specifically ask your dentist to check the gum tissue around your implant. Catching any inflammation early is absolutely key. I want to leave you with one final provocative thought here. You've made the investment, and now you have the knowledge. The tools are incredibly simple, but the consistency, well, that's entirely up to you. So will your implant last a lifetime, or will your daily cleaning routine cut it short? Because at the end of the day, the maintenance is exactly what makes the difference. Thanks so much for joining me on this explainer, and hey, be sure to put this action plan into practice tonight.